Hi, my name is Vic. I'm an ENT surgeon, and in this video, I'm going to explain when you should use a Sterimar Congestion spray or salt water or the NeilMed Sinus Rinse. Now, the clue is almost in the name. The congestion is for a blocked nose. So you really use it for things like hay fever or a cold or something like that to get rid of some of the muck inside your nose. So it's just a spray like this, and maybe I shouldn't have done that. It's all over the place. And that just sprays up your nose and you sniff it up or you blow it out again to get rid of all the bogey or whatever inside your nose. It doesn't do anything else apart from clear out the allergens, clear out the snot inside your nose and help it breathe a bit better. It's a congestion version, so that means it's all about osmotic pull. It's more salty than normal. And what that does is that because it's salty, it shrinks down the turbulence. So it helps you breathe a little better temporarily. So it's quite useful if you've got a cold or hay fever or something like that. It cleans out the allergens and opens up your nose. Now, if you have sinus problems, now sinuses aren't just a blocked nose, it's actually big holes inside the facial skeleton. So all parts of your face here, this is not solid bone, it's got a big hole inside it. And there's holes there's these sort of bits of bone here and also in your forehead here, so frontal, ethmoid, maxillary sinuses. And they keep the facial skeleton lighter so you don't have to lift it up so much. And it gives you sort of resonance to your voice as well and things like that. But the idea is that sometimes these sinuses can get infected in some people because they get blocked off. And so that's where this comes in. This is a NeilMed Sinus Rinse, so that's how you can tell it's for sinuses. You fill this up with sterile water, you pour one of these sachets in, like this that comes with it. You pour that in, you put this on top, and you shake it around like this. So you mix it up. And if you want to make it even stronger, like this one was stronger and therefore shrink down your turbinates a little bit, you can put two of these in, but it does sting a little bit. So see what you can tolerate. These are relatively cheap, but this is a squeezy bottle. You can see that like that. So you pour it in and just try and make sure that the water is about as warm as your hand. So if you can warm it up so that when you put your hand in it, it's a little unsterile when you do that, but if you put your hand in it, it feels the same temperature as your hand. It shouldn't be too hot, shouldn't be too cold, is what we're saying. And so you put this on, this is full of this salty water now, and you put it in your nose like this, and you squeeze slowly. You're going for low pressure, high volume. It's almost the opposite of this. This is high pressure, low volume. Um, and this just cleans out your nose. This one goes into your nose, cleans out your nose, but also goes round your sinuses. And if you've got sinusitis, an infection of your sinuses, all this stuff starts coming out green and brown, and horrible stuff comes out your sinuses, in between your eyes, up into your forehead as well. So you go very slowly and clean it all out. If you push too hard on one of these things, it'll end up in your ears because it gets pushed up what's called a eustachian tube, and you can't hear all of a sudden. It's not very nice doing this. It's not nice doing it either, to be honest. But if you put this up your nose and you go a bit too quickly, it can come out your mouth. It comes out the other nostril. So you make a mess. So do it over a sink. And it's difficult because it feels like you're waterboarding yourself. But afterwards, when you cleaned your nose, you blew in your nose, and you got rid of all the salt water, a lot of people, particularly if they've got sinusitis and other issues, this really seems to make you feel, oh, I feel so much better now that I've cleared all this stuff out. You feel much clearer. And sometimes I say to people after surgery, you get a lot of bogey in your nose and snot, and you have to clear all the crust out of your nose. I tell people to use this at least 4 times a day, and this at the start every hour to clear out their nose. But I said, look, your nose is fine now. You don't need it anymore. But people say to me, you know what? I quite like using it. And they just carry on using it forever. It's a bit like having a swim in the sea. It just opens up your nostrils, opens up your airways. I guess we're built for the sea. We're built to be sort of aquatic creatures, officially in evolution terms. So we do like having our airways cleared out with salt water. It seems to help us feel, it improves our quality of life, according to the research. Anyway, I hope you found that useful. You use this one for hay fever, the cold, and things like that. And you use this one if you have sinus pain. So that's pain in one sinus, loss of sense of smell. You've got green and yellow stuff pouring out of your nose. Um, The complications of sinusitis, you get a big red eye or a swelling on your forehead. If you have any of these things or problems with looking in one eye, go straight to the hospital because that's a complication of sinusitis. But if you're starting to get this problem, you keep having sinus problems, try flushing your nose out with this. This is really useful. You don't always have to get antibiotics. Antibiotics are, useful in really bad infections, but sometimes you can stop you from getting the pain and suffering just by cleaning out your sinuses, let it drain out. You don't need so much treatment. Anyway, thank you ever so much for watching this video. I'll see you in the next video. Bye-bye.